What's up, y'all? Welcome back to From the Ground Up. I am your host, Dr. Becky Allen, and today we are joined by Audra Harris, and I am so excited to have you, Audra.
I am so pumped to be here, Becky. Your podcast is seriously one of my favorites, so it's an honor to be a guest on one of my favorite podcasts ever.
Oh, that's so sweet of you. Well, let me just kind of tell the listeners who you are, and then we'll just dive in and get to it. So Audra is a pelvic health OT, so occupational therapist, and she is the proud owner of Autonomy Pelvic Health. She provides a whole body holistic approach to help adults of all genders reconnect with their bodies and move without fear. She loves blending her background of weightlifting and movement into her care while also making sure her patients feel valued and heard. When she's not in her clinic, you can find her weightlifting in the gym, running, exploring coffee shops, traveling, or spending time with her loved ones. And fun fact, Audra has also been in my ecosystem. We've connected on social media, and honestly, it's been so fun watching you, Audra, kind of pave the way for OTs and pelvic health as well. So I just wanted to say that and give you a warm welcome again, and so happy to have you here.
No, seriously, it's such an honor, and honestly, it's because of your work that I feel like I can help pave the way for OTs and pelvic health. And as you know, there's still people learning that, OTs can be in this space, and it's yeah, we can. And so I think it's just awesome to be able to have a resource like you that I can learn from, and other people other OTs and even PTs can learn from.
Oh, well, I love it. I love being a resource. I love teaching. I love changing the game of pelvic health and all the things, pushing the envelope a little bit. That's the name of the game, right? So on that note, you, Audra, bring such a powerful blend of biomechanics and movement, and then the whole person kind of OT lens of care. And I would love to hear if you can take us back to maybe the earlier spark that kind of put you in or pulled you into pelvic health in the first place.
Yeah, so I actually come from a phys diz background. Fun fact, when I was in grad school, I thought I was going to be a peds OT, and then that just did not happen at all. I did the school setting in my clinicals, and I was ooh, I don't really know if I like this that much, and ended up in skilled nursing for a bit. I worked in the hospital setting. I've worked geriatric psych, you name it. I kind of worked in a bunch of different settings. But what was interesting is when I was in grad school, I always had a fascination with women's health, maternal health. I just thought, wow, the idea of pregnancy is so cool to me. I was the fact that people can do that and deliver babies is just amazing. But I was how do you as an OT do that? Because they talk about an OT that you commonly work in a skilled nursing facility, or you work in the school setting, you do all these things. But it was never really talked about how you can specialize in something related to women's health. So I always kept it in the back of my head. I even did my research into why exercise is really important for reducing gestational diabetes in pregnant people.
So, oh, cool.
Because I love weightlifting. I grew a love for that after I was done with college. I was I kind of want to blend this into my care, but I don't know how. So I just said, well, we'll just keep it in the back of our head because it might come about someday. And I was one of the first people after graduating from school that once we went into our full-time gigs that got hit with the whole COVID era. So literally me and my classmates that graduated in 2019 saw this wave of just this whole pandemic. And it led me to be super burnt out. As a lot of us who've been through that era, I was just I was in skilled nursing full-time, just wasn't really happy with it to begin with. But then COVID was it was a real burnout. And I honestly questioned if I wanted to stay in the profession. And so I just dug deep to say, well, what do I want to do? I spent all this time and all this money in this degree. I don't really want to leave it, but I don't really feel passionate about it. So I went back to that little thought that was in the back of my head of well, what if you found something to do and related to women's health? And so I went into what everybody else does. You go to Google to be how do you be an OT and maternal health or women's health? And nothing really was popping up, but pelvic health kept coming up. Pelvic floor therapy, pelvic this. But what was really interesting was there's a lot of like physical therapy, like pelvic health physical therapy, pelvic whole PT. And I was like, what is this? And so again, I dug, did the research, and eventually met a PT who is local to me who did pelvic floor. And she's like, did you know that OTs can actually do this? And I said, really? Like, who's doing this around here? Because like, I'm not really finding anything. So then she brought me to an OT who's like within the state that does pelvic floor and was telling me all about what she does and told me what courses to take. And I just fell in love with the whole concept. I was like, I love taboo topics. I love breaking those and making people feel comfortable talking about that stuff. And it was not only that, but when I first started learning about it, I went, oh, I have some of these like problems that are pelvic floor problems I didn't realize I could get help with. And so as I started to get into pelvic floor, I went to pelvic floor therapy myself. And this is what really sparked like me becoming the person I am today. And I don't know if you know this story, Becky, but I remember with my first pelvic floor therapist laying on the table about to get my internal exam done. And we always do that little chit chat with people right beforehand. So she asked me what I like to do. And so I said to her, I was like, oh, I love doing this. I love weightlifting and all the things and whatever. And I was going for her for things related to like vaginismus and stuff like that. And I remember her whole just like face kind of changed when I told her I weight trained and I just PR'd in my squat and did all this stuff. And then she says to me, she's like, well, you're not going to want to be lifting heavy weights and you shouldn't do that because you're going to end up with a prolapse if you continue to do that. And here I am just like, yeah, here I am. First of all, just for everyone context, like, you know, you're like half naked on the table with the sheet over your bottom half for a pelvic exam. Not sure what to expect with that really as like newer pelvic floor therapist, but also just like patient at the same time. Being told to not do an activity that actually gave me my life back after I went through like something really traumatic and just being confused about like, what do you mean I'm going to get a prolapse because I'm weight training? And that whole thing just really threw me through like a whole loop. But I'm somebody that's like, I don't like when people tell me what to do. So that whole scenario just pissed me off. And I said, I gotta prove this lady wrong someday like that. No, like this isn't the case. And so I remember going through my whole pelvic floor journey and trying to kind of figure out like who I am and the kind of clinician. And I finally just said, I want to dig deep because I know there's so many other people out there who are in my shoes who are feeling so lost and disconnected in their bodies, who want to be able to be active people but still thrive and not worry about what their pelvic floor is doing. And so because of all those things, this is what led me to be who I am as a clinician. This is what led me to opening Autonomy Pelvic Health. It was just once an idea, and now it's my business. And now it's something that I love doing. Like, don't get me wrong, like running a business is, it's, as you know, Becky, it's friggin' hard. It's so hard. But it's just like, this is why I am who I am today. And this is what led me to here in our conversation.
Wow. I have never heard that story from you in all of these months and years that we've connected online. Thank you for sharing that for real, because I think that the context is so important when we're hearing from successful clinicians, successful business owners to get underneath the success and kind of the what you do, AKA you're a pelvic health therapist, but why you do it. And I talk, you know, anyone who listens to me or follows me on social media, I talk about starting with why all the time. I have the book right here by Simon Sinek, Start with Why. It's literally right next to me. And that is what I have found whenever I talk to people, Audra. The people who are actually doing something meaningful and actually, I mean, what I consider changing the game, these are the people that have that strong underlying why. These are not the people that just, well, I just joined pelvic health because I wanted to try it, you know? And I'm not saying it's bad to do it that way. I'm just saying, like, I love hearing your story because I'm like, of course you have a story that fuels this passion that I see and perceive and I can feel like through the screen whenever I talk to you all the time. So I don't know. Yeah, I just want to say thank you for sharing that because I think that just strengthens your whole vibe as it already was strong. I'm like, no wonder she's doing the dang thing. You know, you have this strong, like whatever you said, I don't like being told what to do or what not to do. Like Absolutely. I am the same way. That's why we probably started businesses, so we could build something that we do on our own terms, right? So I just love it. Thank you for sharing all that, for real. So many OTs are, out there paving the way in pelvic health. And there's this whole thing, or, there has been this whole thing that kind of surfaces on social media or surfaces in, various rooms or things of like kind of the PT versus OT debate and debacle. And I feel like I've heard like multiple sides of it. It's like the side, which I hear a lot less now, which is good, but it's like the side that, this is pelvic floor physical therapy, and like, where do OTs even belong? And I think that side came from just a lack of understanding from the PT side. First of all, that's kind of my thought process there. Then I also hear the side of just like, like we belong and we're the best ones to do it because we treat ADLs and, sex, peeing, pooping, all of that is an ADL, which is true. So I'm curious kind of like, what do you think the OT lens brings to this space, the field of pelvic health, that honestly we need more of in pelvic health?
Sure. And I've heard all this stuff too. And I feel like as a clinician and even just with like my business over, my perspective on all this has really grown and shifted. Like I'm not gonna lie, I used to be like the really angry OT that was like, why do PTs not understand like why we belong here? But then I also realized that it's one, no offense to anybody out there, but like we have to like not be so in the drama about this stuff. Like we need to understand that both clinicians belong in this setting and we work better together, as you say, right? Like we both work better together. And it is so important we see it that way. I think it's important both professions can hear each other out and understand that everybody belongs here. Like we're all here just working together, and we all should be working together to make sure that people aren't falling for the trap of, oh, pelvic floor therapy is stupid, like Kegel, M-Silla chair, whatever that crap is, right? Like that's what we should be fighting against, is that stuff, because like that's not pelvic floor therapy, right? I feel like in terms of just what, we bring to the table, I'll start off by saying this. People always ask me, like, what's the difference between PT and OT in this setting? And I know this answer might piss some people off, but I really want people to hear me out when I say this. There's not a huge difference between the two disciplines in this setting. And that's because we never, as PTs or OTs, we didn't go to PT/OT school and learn about pelvic floor therapy. Like, it's not a common thing. And the gist of like my OT schooling in pelvic health was, hey, if you have a geriatric patient that's like leaking pee, teach them Kegels. Like that's literally the extent of it. And when I talk to PTs, a lot of them say, yeah, we really didn't learn about it either. So we're all kind of starting from the ground up to learn what the heck is pelvic floor? What is pelvic health? How do we help people in this setting? So we all start there. And I do think, yes, there is a bit of differences in schooling. Like traditionally, PTs get more education on the full body anatomy. Not every OT program gets that. Mine didn't. Mine talked about it, but just like how some PT programs, they don't really dive into, and I don't know if you can speak for this, Becky, they don't dive into like deeper, like holistic care, mental health, that kind of stuff. Some do. And it kind of depends on where did you come from. It also depends on what kind of schooling did you do after PT school? What certifications did you took? What was your mentorship like? What are your missions and who you are as a person? So when it comes down to it, I want to say that yes, each discipline is unique in their own way and special and needed. But when it comes to pelvic health, like we can all bring different things to the table because we all truly, no matter if you're PT or OT, are just different clinicians. So when it comes to the world of like, I would say OTs and where we traditionally come from in terms of our schooling, like we really do bring in that holistic approach of looking at a whole person. And when I mean holistic, I'm not talking about like the typical earthy, crunchy, drink green juice, all that kind of stuff. Like I'm talking about like looking at your physical well-being, your mental well-being, your emotional well-being, spiritual. Like in school, we go over how important it is to make sure like you are looking as your person as a whole. And you're asking them like, what do you care about? What do you value? Like what activities do you want to get back into? Or as we call it in OT school, occupations, right? What is it that you're doing? Who is it that you are? And so I feel like OTs with our background in this, we really do bring that to the table in pelvic health. because that's really important. If you work in the pelvic health population, you understand it's not just about like treating a tight or like a weak pelvic floor. It's really diving deeper into the person to be like, what do you care about? Like, why does this matter to you that you don't leak pee when you do this activity? You know?
Oh my gosh. No, literally. And it's like, this is something I've learned as a PT in pelvic health for the past 6 years. It's like, I can have the fanciest biomechanical skills or the fanciest exercises or the most cutting edge, like dry needle precision points and like manual. Like I do have a lot of that stuff. I'm not going to lie. But my patients will not improve with the fancy stuff if I have not determined like what matters to them and what is their why and like what are they afraid of and what do they believe about their symptoms and what are they trying to get back to and what is this symptom prohibiting them from doing and why is that important, and like I didn't know that at the beginning because like you said in PT school, like we don't learn that lens. It's not like they're like, you don't have to care about any of that stuff. It's just like, it's not even in the program, like we might have one lecture or kind of niche course that talks maybe about like, what does biopsychosocial mean? But it's not like application based. It's just like, so they can check the box probably and say, well, this was in the curriculum. I don't know. That's kind of harsh, but that's kind of the way I remember it. And I do think it's program specific. I think my program that I went to was great. I got my degree. I'm a PT, all the things was very like biomechanics heavy and manual therapy heavy. And that came from, looking back, like the professors that taught the majority of the courses, they liked those things. They liked the biomechanics. They liked, manipulation and manual therapy, which is all good tools, but it's like that was what we were inundated with. And so as I got into pelvic health and as I started to realize like, holy crap, these patients need so much more than do clamshells, do a like strengthen the glutes, do a Kegel, coordinate the core. Like that is all just so surface level. And like, honestly, if I hadn't opened my eyes and truth be told, like my second hire was an OT and I had no idea what that would look like. She applied for the job and I was like, well, I like Googled it. I'm like, they can legally do this. Okay, let me talk to her. I need to hire someone, and I loved her as a person. She had a great lens of like, what she can bring to Genesis, what she can bring as an OT, and helped me to see how it fits in pelvic health. And so truly like bringing her in from the get-go. And since then we've hired, we've hired 4 total across our team and are interviewing a couple more right now for our open position, which is fun. But I think that was a pivotal moment because I was able to kind of see it in action on my own team and realize like, oh my gosh, like the way that she's talking about her patients and how she's caring for them and helping me with, my cases, because we would ask the team, like at that point, it was me, Corey, and then her, the OT, Lisa, and we would ask each other about our patients and like the way that she would talk about things, it was just like eye-opening. And so I think for me, that helped catapult me into this idea of like, holy cow, like not only do OTs belong in pelvic health, but honestly, y'all are way more equipped. And like, let me just teach you about the foot and like, you'll be good, Like that's kind of how I feel about it, which is just wild looking back. It's like, this is truly like an OT's profession that PTs are just, thanks for letting us be here. Like that's how I feel now that I'm in it. So it's funny.
Yeah, exactly. And I have to say, like, we give a lot of credit to, PTs who really started to pave this wave initially, because that's where, if you think back, that's where we have a lot more of our initial research when it comes to like pelvic floor and things like that. It's related to physical therapy. So it's great that at least like we've had one of our professions to be able to really start and pave the way, and then having OT come in and help with things. And I just think like what I always notice with any OT I talk to is we really learn to be like out of the box thinkers. And you see this across like any setting with OT. Like we just learn to think outside the box because each person you come across is so different and doesn't necessarily have all the resources that maybe you think they would initially need to help them with their problems. But we learn, hey, you've got to like think of things differently and not be so black and white. And one thing I also noticed too that OTs do really great at is we always talk about like people's sensory systems. Like that's something that doesn't get talked about, I think, enough in the world of like pelvic floor. Like biomechanical stuff is so important, but what drives biomechanics is also people's like sensory systems and nervous systems. And so it's really cool to see OTs tying that into things as well. Which is why, again, I always say like PTs and OTs, when you kind of look at what it is that they can do in pelvic health, well, sure, they come from different backgrounds, but like we can always learn things. Just like how's an OT? I had to relearn the anatomy for pelvic floor and, you know, the lower extremity and stuff like that. I think that's what's special about this whole setting is it doesn't matter where you come from, you have the ability to learn, whether it's you're learning soft skills, you're learning biomechanics, you're like learning
communication, like literally communicating with our patients. They don't teach us that.
Oh my gosh, that is so true. It doesn't matter if you're a PT or OT, like how many of us when we took on our first patient were like, I don't know what to do. Like you just sit there and you're like, how do I help
literally
this person?
Like I remember my first official eval was a post-op knee replacement, which is for a PT, that's like a softball. Like that's going to be so easy because I was in, outpatient PT, and that's like one of the easiest ones. You get it, you do your measurements, you give them like the standard exercises because they're like, 4 weeks out from surgery so they can start doing stuff. Anyways, and I just froze. I remember being like, what do I do? What do I say? What do I do? And I just like walked over with my goniometer and just like, I don't even think I talked to the person. I was just like, hi, I'm Becky. I'm like, gonna take my measurement. And then I sent the tech over because I was just so like, anyway. So yeah, it's like such an underrated skill as knowing how to communicate and how to like attune like this idea of like, yes, I'm listening. Yes, I'm like asking questions, but it even is deeper than just asking. Because I always talk about like, we have to ask better questions. We have to be better listeners. We have to be a detective, all those things. And you have to be able to understand this concept and put it into practice, this concept of attunement, which I've heard it described, which is like getting in someone's well, which is like, they're in this pit, this well, and it's like you're there with them and you're helping them to kind of see the walls of the well. And there's the top of the well. And it's like, I'm here with you. And it's not necessarily right out of the gates that I'm going to fix you. It's not that, I'm just checking off boxes on my eval sheet. It's like, I'm here with you. And that skill alone has literally changed everything about my practice because it's like, patients, they can't put their finger out, but they feel that. It's the nervous systems that are kind of like intertwining, which sounds woo-woo, but like, listen, it's a real thing. And that is what builds that trust, that safety. And so like, that's changed things for their outcomes. That's changed their, commitment to a plan of care. That's changed their retention. That's changed their cancellation rates. That's changed business profitability. And it like literally all comes back to communicating with the human that's in your room. So I don't know, but that was a great tangent, a tangent nonetheless, but I'm here for it. I am curious, Audra. So you launched Autonomy Pelvic Health, which that name alone says so much. What felt missing kind of in traditional pelvic health models that you knew you had to start your own thing and like do things differently, do things better?
It was so interesting going back to the whole PT and OT thing. I had worked 2 different outpatient jobs under the insurance model. And the second one that I worked under, I was like their first OT that they hired. The job posting was pelvic floor PT. I was like, I'm just going to apply for it because maybe they just don't know OTs can do this. And they did it. And they were really excited to hire me and have me on and learn from me. And, that was great. But what was interesting to me was the model that I was working in. Even though I say there's really not this huge difference between PT and OT, I kind of felt like I had to be almost this like PT, whereas like I'm an OT and I was wearing this skin where everything was like, okay, you've got 40 minutes with your patient. So at this place, I had 40 minutes for evals and treatments. We all know that that's just not super ideal. It's better than 30, but like in the world of pelvic health, you have to work in it to understand that 40 minutes is just not a lot of time with somebody. Because I would have these people come in and they would just be teary-eyed. They would be scared. They would be this. And I was like, okay, I've got to like try and sit and listen to them, but then also be able to like go back to my boss and say, yeah, when you look at my notes, like I did do some kind of assessment or gave them some kind of exercises, because I get questioned on that. Like, how come you don't have a lot billed for this or that? And it's like, well, because I'm here to sit and listen to this person who's coming to me, who's been thrown around the medical system or failed by it or gaslit all the time. And then here I am trying to be the person to sit and listen to them. But then I've got this, person sitting on my shoulder that's like, you got to make sure you send them with exercises, and you got to make sure that like they're better in this many visits in this many weeks. And it just never felt right. Everything felt rushed. I was like burnt out. My patients, I think I've had people get better, but then I had people that just didn't, or sometimes you had people who just didn't come back. And I was like, do they not come back because something on their terms? Did they not like my approach? And I just felt like that's what was missing, was being able to really sit and connect with my patients and listen to them and talk to them and hear them, because I forget who it was that said this, but they said, if you just give your patients a chance to talk, when you listen to them, you're going to hear what the problems are without even like putting your hands on them. You're going to hear it.
I love that. I need that on my wall or on a t-shirt. I love that.
And I was like, who is it that said that to me? They're probably going to listen to this and be like, Audra, that was me. Why did you not remember that? Like,
we'll tag him. We'll tag him.
We'll tag him into the post. And it's just something that really stuck with me, because like I said, I was the patient, and the people that I felt like I've done the best with, like as a patient, were the ones where I felt like, wow, you actually hear me and you listen to me and you care. And these are the people that I also see who have done the best working with me, is when I gave them that opportunity to just sit and talk, and I hear them and I understand them. Even if I don't know, like, can I be the person that is going to help them or help them in some degree? Just by listening, you do a lot for people. And that's one of the reasons why I opened up my practice. I just felt like, personally for me, the insurance model was just failing a lot of people. And I'll say it's not everybody, but like, how many times do you have to be on the phone with somebody with this stupid authorization, or the time I had to explain to, no offense to men, a male PT that had no understanding in pelvic health of like, yeah, so my patient who's been traumatized, in 2 different ways, has vaginismus, and this is why she's not better in 8 weeks. And they're like, well, because of her insurance plan, you can only see her for another so many days, blah, 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 blah. And I was like, that was just kind of what broke things. I was like, I'm done. I'm done explaining why my patients deserve the care they need to somebody who, one, is not in the setting, but also just doesn't get it. Like,
yeah. No. Yeah, there's that deeper why again, which I love. So then you spin off, you start Autonomy Pelvic Health. How old is Autonomy now?
And it's over 2 years old now.
Okay, that's what I thought. I didn't want to say it, but I was about to say I think it's 2 years old. I'm curious, as a visionary myself, what does Autonomy Pelvic Health look like 5 years from now? Like, what's your vision?
My vision is for this clinic to have more than just me as a practitioner. Like, I want to have a pelvic health clinic that is open to everybody and everything. Like, I would love to have other clinicians work with me, whether it be PTs, OTs, whoever wants to join in, and to just be able to have a business that serves people all across terms of pelvic health, right? Whether you're an adult or pediatric, I'd love to be able to have that. I want this practice to be the practice that people see where I am. I'm in central Massachusetts. I want people to be like, okay, this is the place to go, because these are the people who care. These are the people that are willing to work with you to help you get better, and to just continue to just change the game in pelvic health and teach people that it's more than just like strengthening or lengthening. You're doing all this stuff and continuing to build and learn in pelvic health. Because as you know, we're always learning new things about science, and the research is always coming out. And I want my practice to be a resemblance of that we're willing to learn, we're willing to listen, but to also just build community and help people. Like, I want people to see that we're not just here to support you pelvic health wise, but how can we also build a community to support you as the whole person that you are?
Oh, I love it. I always joke, I'm like, don't you want to move to DFW and work at Genesis? But honestly, hearing your vision, I'm like, you probably need to stay there and change the game up there because Lord knows I'm not opening a Genesis up there. No, like, no offense to Massachusetts. It's just, I have learned my lesson of trying to go across state lines. But I love that. I love that. And here's a question that I love to ask. And you brought it up a second ago when talking about kind of changing the game. What does changing the game mean to you in pelvic health?
Changing the game to me is really, again, challenging people to really look at that whole person and just being able to dive into that unknown or like what's scary and continuing to challenge yourself as a clinician to just keep learning because there is so much that we know, but also so much that we don't know. And this is the kind of setting that's perfect for people who are lifelong learners. Like I'm always learning stuff every day, like whether it's something really small or really big across PTs and OTs, it's amazing to me. But I just want people to be like open to learning and changing perspectives, but also just trying to get people to continue to work together, because at the end of the day, it shouldn't be PT versus OT. It should be PT and OT together working to provide the best possible care for patients and just continuing to change the game of pelvic health, even outside of our professions, right? Being able to sit and have conversations with other clinicians and doctors and even people outside of healthcare to say like, hey, pelvic health's a big deal. Like, let's treat it that way and let's help people.
Yeah. Oh my gosh, I love it. It's like what I always say, like, let's do things differently and do them better. And to do that, you do have to be a lifelong learner. You have to have an open mind. You have to stay curious. You have to work together across disciplines, across specialty, like just all the things. So, oh, I love it. Let's change the game, Audra. Let's do it.
Yes. Yes.
Okay. I wanted to end with like a fun little rapid fire this or that round. So no wrong answers, but you can just pick one or the other as we go. Okay.
Oh gosh.
So, no, you're going to do great. You're going to do great. So coffee shop or homebrew?
Oh, coffee shop.
Morning person or night owl?
Oh gosh, I'm really neither, to be honest. This is like a afternoon duck. Sound about right?
We'll take it. We'll take it. I don't know. Lube or no lube?
Lube.
Love it. Act off your intuition and gut or act off of data?
Ooh, intuition. I'm learning to do that more too. Like,
yeah, I love it. Breath work or glute work?
Ooh, breath work. Yeah. Always important foundation.
Right? I know. It's like a little bit of a trick question, but I'm like, both, but it's like, if you're going to have to pick one, it's got to be the breath. Okay, last one, squat rack or running trail?
Ooh, squat rack for sure. Oh,
I know. Because you do run too, though, right?
Not like as much as like I'd like to, but like I do like running. But if I could pick, I'd be under the barbell. Watching me run's a little embarrassing right now. So,
well, I don't run. I'm a walker though, so they say that's great for your health. Well, thank you, Audra. Thank you so much for being here. I knew it was going to be a great show, but it blew my expectations out of the water just because you're so authentic and funny and smart and open and willing to share. And that's honestly what the people need and what we have to change the game of pelvic health. So thank you so, so much for being here.
Thank you for having me. Seriously, I'm over here just like trying not to blush at all the kind things you're saying about me. This has been fun and amazing. And I just hope you know that I appreciate you so much as just clinician, educator, human being. Like you are amazing. Thank you, Becky.
Oh. Well, I was about to yell at you and be like, receive it. And then you try and say all that to me. And I'm like, okay, we'll both receive. We'll both.
I squeezed it in before you could say anything to me.
Oh, you did. I love it. We'll both be better at receiving the compliments because I love it. Well, thanks everyone for listening. And please screenshot this episode, share it because this is one that pelvic health clinicians on both quote unquote sides, PT and OT, which by the way shouldn't be sides, need to hear, because this episode is one that will truly help us move the specialty in the profession of pelvic health forward. And so definitely screenshot it, definitely share us, and then DM us, DM both of us. You can get our pages in the show notes, and we love to message with y'all. We love questions, we love curiosity. So please feel free to DM us. We love to see it. And you guys, let's change the game.